Welcome to Love ADHD, everybody. We're very happy to be here. Welcome, Tony,
Hey,
to
Julie.
your own podcast.
So I'm happy to be here. It was fun that right before we went on, I was talking about hitting the record button, and you're just nice. You're like, "Oh, good job." And then what was happening there? You retracted it for a moment. Tell me about
Well,
that?
I was saying good job, then I was like, good job. Just waiting my turn. I've been working on not interrupting. Apparently, that's a thing
Oh,
with ADHD.
okay. If people, yeah, if people could watch the video of us right now. We both just look like, okay, there it is. Because when I've had to edit, we do that a little bit. And sometimes I'll edit out some of my stuff that I'm saying while you're saying things. So then it just makes it sound like we're not as much. And then I realize, wait, we're trying to be all authentic and stuff.
Also, trying to be the best version of ourselves. Also, trying to be considerate. I'm working on it. It's hard. There's a little bit of a time lapse too, though. So I think we got to give ourselves credit there. I feel like there's just a tiny bit of a time glitch with Zoom.
Oh, I was just thought that you meant in life. I'm saying, okay, yeah, it's a little pause. It was last night. There's a client, and I just come off my men's group, and we were rolling, and I go right up till the end, and I'm like, sorry guys, I gotta go. And then I jump on this next. It was a virtual appointment, and I said to the guy because we both have ADHD, and I said, I am going to not have ADHD for this entire session, and I'm gonna be very smooth and authentic and calm. And then I lost it, but I made it like 25 seconds or so.
That's funny you claimed you were going to be authentic but not have ADHD.
I know. It's a
That's fun.
paradox, right?
Hmm.
Did you teach English?
I taught second grade.
Oh, okay. Okay. Because when I said paradox, I'm like, what's a hyperbole? And then what's a parabola? And there's my ADHD.
Oh, let's not. Let's not
Okay.
go down that
That's what
because
we're talking
neither
about
of us are
today.
qualified for those ones. We also are talking about something we're not really sure that we're qualified to talk about either,
Well
but
done.
we're still going to talk about it. A lot of the feedback we've gotten on this podcast is people wanting help with parenting a child with ADHD. I also want help with that. Do I know that I have a child with ADHD? Not necessarily. Do I have suspicions? Yeah, especially because it's such a hereditary thing. I was looking through some different articles about it as I've tried to inform myself and as I've tried to also understand my own childhood. And I found one that I thought broke down just some tools of how to be a more effective, compassionate parent to a child with ADHD. Did you have a question?
Oh, I thought maybe this could be the way that then if I raised my hand, but you didn't have to point it out, and then it would be real smooth and we wouldn't interrupt each other. But now I feel kind of rejection sensitive. So no, I'm good.
Tony, will you add your thoughts?
Oh, well, thank you. Here's what's funny. When you were talking about that and when we were trading texts about the topic today, and I was telling you, I really don't know much about ADHD and with kids because I don't work with that population. But I like that you just said parenting a kid with ADHD because that I feel like I can weigh in on because the parenting model that I use, it's a parenting model. I mean, it's the nurtured heart approach, but it was initially designed to work with kids that have oppositional defiant disorder. That's a big one that then eventually can lead down the road to maybe a good old personality disorder. So I think a lot of the same stuff can happen here because the kid is going to feel that rejection and they're going to feel not heard and seen. And so I like that we're going there. So I can weigh in on that. Back to you. Okay.
Okay. So we're just going to kind of spitball a little here. You also happen to have a lot of wealth of knowledge of ADHD in general, but we're going to try to apply this to kids and see what we can figure out between the two of us. So it's going to be fun. So are we qualified? Sure.
No. Or yes.
So we are human beings who are allowed to talk about things. So today we're talking about how ADHD affects kids and what parents can do to be helpful. First of all, I just want to go through some of the things it talks about what might look like inattentiveness, hyperactivity,
Mm.
and impulsiveness in kids with ADHD. Okay.
Okay.
For example, some of the inattentiveness you might see in kids might be they seem distracted, seem not to listen, have trouble paying attention, not following directions well, need many reminders to do things, show poor effort in schoolwork, and have trouble getting organized. Okay. I mean, those
Yeah.
those track well even as an adult, right? All of those things I can relate to.
They do.
Okay,
And
now if we
oh, yeah. See, I
no,
did
you
it
go
right
ahead.
there. I did it, Julie. I did it right there. I was just going to say, but I already like where we're going because I could make an argument for things that may not be ADHD that would also present like that. So I can understand why especially if somebody doesn't want their kid to have ADHD, if there's like the shame or the stigma around it, then they're maybe just saying, well, no, he's just bored, or that's the teacher. Teacher needs to challenge him a little bit more. So it's not ADHD.
Yes. Well, and that, of course, reminds me of our podcast we did with Mackie, right? Where we compared and contrasted ADHD
Yeah.
with anxiety.
Anxiety.
That podcast was so helpful to me because I have wondered, because I have been treated for anxiety for so long, that doing that podcast was so helpful for me to see the way that it looks the same and the way that it looks different. And it actually
That was
made me
nice.
more sure of my diagnosis of ADHD, having Mackie talk through it and me talk through it
Yeah.
and how it can look the same, but actually it's very different.
Very different. Yeah.
Okay, so that's the inattentiveness piece for kids. Okay, now here's some symptoms that could be hyperactivity. Kids with ADHD may climb, jump, or roughhouse when it's time to play quietly, fidget and seem unable to sit still, rush instead of take their time, make careless mistakes, be on the go, in parentheses, constantly in motion. Okay.
Mm.
For me as a child, I relate with half of those and half I do not.
Hey, okay, can you, and I wasn't thinking of it in terms of me as a kid, and I will, let me just say here that I know that a lot of people will say, because it's still, adult ADHD isn't readily diagnosed, and a lot of times when it is, the people say, well, did you have ADHD as a kid? And if you didn't for some reason, and I think that's changing a little bit, then it was almost like, well, then you can't have as an adult. That was what I was met with initially. But then I had a good therapist that was doing the assessment that said, well, you just learned how to, in essence, mask, or you were able to get away with things. So will you go through that list one more time? And I want to listen to it as if my young child self.
Well, okay, let me clarify first though, because I like what you're saying. My understanding is if ADHD is, I mean, it's hereditary.
Yeah.
If that's what we believe,
Yeah.
which I
Yeah.
believe it is, and I believe there's
Yeah.
research to
Yes.
back all of that
Oh,
up,
absolutely.
then if you and I have ADHD as an adult, we had to have had it as a kid. We were
Yeah.
born with it, correct?
Yeah. We did. But yes. Yes. And not yeah.
But we
But yeah.
found coping mechanisms to
Yes.
mask it as a kid.
Yeah.
So that's why it was undetected as a kid.
Yeah. And
And
and it wasn't just that it was readily diagnosed, and it wasn't like my parents were taking me to the doctor to find out about whatever something was. I was just hyper and annoying, but a bunch of fun too.
And I'm guessing depending on how safe you are in your childhood and your how stable and consistent your environment is as a childhood, I would guess that would really play into whether or not you have to find ways to cope with it
I like
and
that.
whether you're able to present your most true self. Would you say
Yeah.
that's correct?
Yeah, because I can think of some clients that I have that are aware of their ADHD, their kids' ADHD, and they are very accepting with kind of the free range roaming, and then not, and it sounds probably negative to parents who don't, but where there aren't as many expectations, but there's a lot of support and validation, I guess.
Yes. Yes, I love that. Okay, so let me go through hyperactive one more
Okay.
time.
Okay.
Inner child, Tony and Julie, listen. Kids with ADHD may climb, jump, or roughhouse when it's time to play quietly, fidget and seem unable to sit still, rush instead of take their time,
Gotcha.
make careless mistakes,
Right. Righto.
be on the go, constantly in motion.
Yes.
Okay, maybe I agree with four of the five.
I think I'm with you
Yes.
there too. I really don't think I did my leg bouncing up and down. Now I'll pick my cuticles and play with my fidget cube like nobody's business. And you know what? Maybe I did that too. I guess that wasn't anything I was aware of. I've always struggled with it's so funny when people are just hammering their leg like in the pew at church and the whole thing's shaking. And I think, oh, I don't do that. So then I must not have had it, or I don't have it. But okay, so I miss one symptom. Yeah.
Well, and don't you just do it different? Because my brother with
Yeah, I'm
ADHD,
doing it
he
right
does do
now.
that. He does it big time.
Yes.
But you and I pick
Yes.
our cuticles till we bleed. And I bit my nails since I was like 3 until they bleed. And I'm 33 and it's still the exact same problem.
Yeah.
Or I'd rub glue all over my hands in science and dry it so I could pick it off.
I would do
It's the only
that.
way I got through.
Yeah.
Okay. Last part we're going to talk about is another part of when is it impulsive technically a part of hyperactivity?
hmm hmm
Okay. They have it separate from hyper. So they have inattentive, hyperactive, and now impulsive. Kids, okay, because they're impulsive, kids with ADHD may interrupt a lot, blurt out, do things without thinking,
Okay.
do things they shouldn't, even though they know better.
Yeah, okay, I'm with you. I love this. I'm like, no, I don't think I do that.
I like that I'm just diagnosing you too.
You're
I'm like,
good.
you do that. Have trouble waiting, taking turns, or sharing. Have emotional outbursts, lose their temper, or lack of self-control.
So I wasn't as bad there, but I think that's part of that. I got my validation from whatever, being funny, sports, that sort of thing. So I don't feel like I had to do that because I think that some of that's maybe a little bit of validation seeking. The one about the turn taking, what was that one? That one, I remember taking that on the assessment and I was trying to ace the assessment. So I'm like, what's the right answer?
Right.
Because I never
No.
had that problem, I don't think.
Have trouble waiting, taking turns, or sharing.
You know, it's funny. I didn't have problems. I was able to find a way to get up to the front, so I didn't have to. Okay, sure.
Yep. Yep. So the article goes on to talk about parents might not realize that these behaviors are ADHD because, as we've so often talked about before, like all of these things any kid can have, every kid is probably going to do every
Right.
single one of these things at one point. And so for me, I understand it as it's consistent enough, it's really impacting your life, your ability to socialize with other people, your ability to function in different environments. Sorry, hang on, my phone keeps going off. Can you
Oh,
hear
you're
it on
good.
your end?
Huh? No.
Okay, I just silenced it. So that's why a lot of times they can go undetected, obviously, in their kid, is because a lot of these things can happen, but you see it happening more consistently. This is ways that, as the biggest thing the article talks about is that parents just become crazy educated about ADHD, right? You always talk about on
Mm-hmm.
your Waking Up to
Mm-hmm.
Narcissism podcast, getting your PhD in narcissism. I think if you wonder about your kid having ADHD, you
For
want to get your
sure.
PhD in ADHD.
Yeah.
But there's just about 10 of these tips that are pretty simple that I found really helpful. And so let's just go through them and tell me what you think about these. So first, be involved. And that's what, coming back to what I just said, learn everything you can about ADHD,
Okay.
everything you can.
And can I throw the 2 cents in there where I think that a parent, if they can get out of their own head of that there's something negative or wrong if their kid has ADHD or that they did something wrong. And I often throw out I know we've talked about it here, but we make an observation and a judgment. We do it just naturally. So if we observe our kid being hyper or they're not paying attention, then we make a judgment that they must not care or I'm not strict
Mm,
enough or. And so then if we then try to go in with that and the kid doesn't respond the way we want them to, then we even get more angry because they're not even being honest with themselves. And if we can separate that observation from judgment, then here comes curiosity. And then we can start with hey, champ, tell me what's going on. So I think that I like that one because getting it, you're so right, get educated, but it doesn't mean that anything is wrong with you or your kid. And then you have to know that you don't know what you don't know, which I think is really interesting.
yeah, and what I love about what you're saying is that it seems like the more a parent can separate their identity or their ability as a parent
Mm-hmm.
or those different things from it, they're actually more likely to notice that it's ADHD,
Oh, that's good. Yeah.
right? Because
Yeah.
they're leaving room for that. They're not like giving all these reasons of why they're acting this way. If they are more curious, they're actually a lot more likely to be like, "Oh," and notice how consistent these behaviors are.
Yeah, because if you want to get rid of your discomfort, then you can just say, I did stuff like that when I was a kid too. They're fine.
Yep. Yep.
Yeah. Okay.
Okay, let's talk about the next one.
Okay.
Know how ADHD affects your child. So
Oh,
every kid is different. Identify the problems your child has because of ADHD. Some kids need to get better at paying attention and listening. Others need to get better at slowing down. See, even I hear that and I cringe just a little. Need to get better at. I'm like, yes,
I know, right? I'm
we all
same.
want to become the best version of ourselves, but you're feeling what I'm feeling a little bit,
Oh,
right?
so much, so much.
Ask your child's therapist for tips and ways you can help your child practice and improve, assuming that your child is receiving therapy.
Yeah,
Focus on teaching your child one thing at a time. I love this.
that's good.
Don't try to work on everything at once. Start small, pick one thing to focus on, praise your child's effort. That to me matches up with just the way I work in general, right? The
Hmm.
little tasks. the
Yeah.
momentum that builds and seeing that I can be successful because I
Yeah.
am so overwhelmed by the big
Yeah.
picture. But if I do small little tasks, so that makes a lot of sense to me. Obviously, if you can or if you feel like it's helpful working with the kid's school. So if you know that your kid has ADHD, I don't know, I know parents have really different opinions on telling the teachers if their kid has a label and what that means and all the things. I don't know, I think just go with your gut on that one, but
Well,
I
I will say yes, and because I still feel like though, and I told you I have something from the ADHD 2.0 book about even medication and with kids, and so this is where I go back to like when we were saying to get educated about it. At some point, we've talked before about you can't just try harder if you have challenges with your executive functioning skills. So that's where I think, okay, yeah, some of the labels maybe aren't helpful. And we've talked before. If it is, it is. If it isn't, it isn't. I like to start
yeah.
there. But if it's going to help your kid, then I would rather err on the side of label if it really is going to, if I just think my kids, and this is now going to sound dismissive about, anxiety, but if I feel like my kid's nervous or anxious, I can understand. I don't want to tell somebody, I think you might have generalized anxiety disorder. But if they have ADHD and their executive functioning skills are not what they are, what other people's are, then we're looking at the world of even maybe some accommodations and I think this is because the school system, bless its heart, is still set up pretty antiquated of pre things like ADHD yeah, and I might get hate mail or hate email for that.
Well, I have a question about that.
Yeah, yeah,
Why, help me understand why you would say if it were general anxiety disorder, you'd be more hesitant to share than
yeah,
ADHD. Explain
yeah,
that to me.
yeah. Because I like if it's an anxiety disorder, if it's then can be met with okay, if it's you can I don't know if it's somebody that's let's say they're with a teacher that maybe reminds them of because I had this one time, so I don't want to get all dark or anything, but it's like a client who their kid was in a classroom with a teacher that reminded them of someone that there had been some abuse. So there's going to be
Oh,
some anxiety there. So if that's then we're trusting the kid's gut, and we're so grateful that the kid comes home and tells the parent. And so at that point, man, thank you. And so we can, if we're saying, okay, they have an anxiety disorder, but the kid's like, no, I'm scared to death of this person, and I don't know what to do with it. But then all of a sudden, you move them into the next pod, and now they are with somebody that reminds them of their grandma, and all of a sudden, oh, it's solved. So that's one. But if it's a lack of executive functioning, you've got a teacher that is a bless their heart drill sergeant that says, okay, we're all about order and these tasks that we have to get done, these little menial tasks that he or she finds very satisfying because they like order and rules. But then the kid, that good luck. Then I'm saying, hey, ADHD right here. Like this kid needs to be popping Ritalin like M&Ms if they're gonna stay in this class. And I don't know how I feel about that, you know?
yeah,
Yeah. But
I
but
do. I
I like
do.
you asking
Yeah.
that question. Yeah, that's a great
Yeah.
question though.
That really clarifies it for me because one is there is more nurture there, right? There is more
Yeah, I
of
like
an
that.
experience that's happened to
Yeah.
give them that anxiety, right? Like there's a little more. Whereas from everything I've read and understand, true ADHD is pretty darn just
It just
is.
is.
It just is. There's not really a lot you can do to impact it being created or out of
No,
nowhere. It just is hereditary. In that way, it simplifies it a little.
I think
Not as
so.
complicated of where it comes from. I don't know. There's some piece that comes to me with that is it simplifies the answers a little bit.
Yeah.
I remember when I first talked to my own therapist about ADHD and what to do about it, he was like, honestly, with ADHD, like with anxiety, depression, yeah, meds can be helpful for sure. Sometimes people want to use them, sometimes they don't. He's like, with ADHD, there's only so much counseling to do. That's why it's
Yeah.
usually like it's treated with medicine because can't really counsel your way out of it near as much as other things. And while some might see that as discouraging, I found it helpful because that it makes a lot of sense of my experiences where the intention and the hard work is there and yet we're hitting the wall, right? Yes, Tony.
Oh, thank you. I don't want you to have to do that, but it's kind of funny now. I'm probably gonna do it.
It's fun.
Yeah, it is. I really dig. By the way, I see you, author of a book literally called I See You, Julie, of that you are not trying to jump in, and I almost feel bad but I know you're working on. So if it's a value-based goal of yours and not you're not trying to do it because you think you should, then well done.
I'm thinking about that.
I know, right?
What kind of goal is it? to not jump in. Thank you. I really have been working on it a
I
lot.
can see that for real. We haven't talked
You
in a
are
couple weeks.
noticing?
Oh yeah. Now I feel like I'm the guy. No, I was like, no, no, Julie interrupts more than me. Now all of a sudden you're like not interrupting. I'm like, right, Julie? Like I'm even trying to jump in when you talk. See, there you did it. No. Okay. I can't
I
forget
don't
my
know why
point.
being quiet, I have to suck in my nostrils too. Keep it
Okay.
in, keep it in.
All right. Oh, so I remember what I was saying. So
Yeah,
what I like a lot that what you just said. I forgot, but now I'm filibustering and it'll come back to me. But it was about the therapy because as a therapist, shockingly, who has ADHD, I do have a lot more empathy and I do understand more. And I know that therapy is, or therapists are on their own therapy journey, even though I didn't think I was for about a decade, but it absolutely was. So I like the fact that what your therapist said is so accurate. But then as a therapist with ADHD who has done a lot of work with my own, and now that you look at it, and we've talked before, it's not like a, well, it's my ADHD, but knowing it now I have been able to include that in my therapy process. So it is going to I'm going to need to double down on meditation to build in an even bigger pause. I'm going to have to find my right kind of difficult and have to probably deal with a little more invalidation from others because I'm going to do things that maybe other people don't think I should do. So I think I can still bring my ADHD into therapy and therapy well, but I'm aware that it takes a little more because of some of the wonderfulness, aka challenges of ADHD. But I like what you're saying though, but then there's so much of it that is, oh yeah, the stunted, the whatever dopamine neuroreceptors that don't quite shake hands with their buddies, and so they need a blast of feel good chemicals to have liquid or hope. So that's a thing. I realized halfway through that where I was like, oh, I'm on one here, but it's not liquid actually, but fair enough.
liquid hope.
I know. I'm like liquid. What's another one? Yeah.
I like it.
Hey, is this when your guy said or person said that it's more about medication? Can I throw a fun fact in about medication
Please,
from the Bible, aka
please do.
ADHD 2.0? I don't say AKA once in a normal day, and I just said it twice in a 5-minute span. I don't know what that's about. Here we go. Okay. From ADHD 2.0, addiction and abuse. They say, spoiler alert, taking a stimulant or stimulant like drug early in life helps prevent, not promote addiction later. Since 80% of addictions get started between the ages of 13 and 23, and since people with ADHD are far more prone to develop an addiction than the general population, and since taking stimulant medication reduces the risk of addiction later on, it makes a lot of sense to start a child on stimulant medication before age 13. Addiction and abuse are understandably some of the main concerns cited by those reluctant to take an ADHD drug, and the concerns are valid. In fact, ADHD drugs are listed among the top drugs abused by high school and college students. But it's important to note, though, that ADHD stimulant drugs are mainly used inappropriately by those not diagnosed with ADHD, the stay awake study drugs. These neurotypical abusers use them to stay up and study or mix them with other drugs of abuse like alcohol, marijuana to intensify the high, among other reasons only teenagers can come up with. But it's far less common for those who have ADHD to purposely take far too much of a stimulant medication. Long-term studies found that those with ADHD who are successfully treated with stimulants become addicted to substances far less than the general population, and certainly less than the population who have ADHD and do not take stimulant medications. This is what gets scary a little bit. On the flip side, teens who have ADHD and are not treated are 5 to 10 times more likely to become addicted to substances. It's a myth that people come to psychiatrists to get the highest dose and greatest number of pills. Indeed, one of the biggest problems we encounter is that patients do not take the total prescribed dosage for the month. The tough part is keeping them on the medicine, not making sure they aren't angling for an overabundance of extra strength medication. And then he said, that being said, when people do go off stimulant medication, they can experience slight symptoms of withdrawal. And this happens most every evening. And the symptoms can be so mild as to be missed, or they can lead to increasing tiredness, anxiety, aggression, or other presentations, which then they go into the concept of side effects. But that was wild to me. And my daughter Sydney is diagnosed with ADHD. We're doing these TikTok lives. She's being so vulnerable and open, and she's been talking about quitting vaping. And it's one of those as a dad where I was like, I didn't know she was doing that. So I had to sit with my own. And so then at that point, though, we were talking about this a couple of nights ago on a live, and I was grateful for vulnerability because let me go back a page, because that's where ADHD teens who have ADHD and are not treated are 5 to 10 times more likely to become addicted to substances. She just right there, she's like, that's it. She said, I went to other substances because, and she talked about when she got medication. I thought this was so cool. It's only been a couple of years ago. She's 22 and her room's always been a disaster. She admits this, but then the first thing that when she got on medication was she cleaned her room and it's been spotless for 2 years because she said now she needs that. It kind of thought of you, my friend. But
Hmm.
but until she was medicated, she couldn't focus enough to do that. And now that she's medicated, she's now people online are following her stopping vaping. So I just feel like that's so powerful to put that out there.
So powerful. Yeah, and medication is like its own series of episodes, probably.
Yeah.
That's a lot of questions we've gotten as well.
Yeah,
Do
yeah.
we have time for a couple
Oh
more
yeah,
tips?
yeah, yeah. I got 5 more minutes, Julie.
Okay. Connect with others for support and awareness. As parents, it can be really good to join some sort of support organization for ADHD. I like this one. It says, find out if you have ADHD. As we
That's
talked about,
good. Yeah.
ADHD often runs in families. Parents or other relatives of kids with ADHD might not know they have it too. When parents have ADHD, get diagnosed and treated, it helps them be their best as parents. And that makes me so happy because, like I said, I do have a suspicion about one of my children having ADHD. The
Mhm.
more I've understood about myself and just watching those behaviors as they've grown up. And it's this heartwarming thing. Well, I've never said anything to them and I haven't decided exactly what's the best way to treat it and to help it because how young they are. It's kind of a sweet thing for me to be able to watch and to frame it around this. And I'm starting to see
Yeah.
more clearly and feel less frustrated
Oh, that's nice.
about why do you still not have your shoes on? Why, and I'm starting to just pick up more on when they look at me and they're like, oh, and I can literally tell they forgot and they're not trying to be disobedient.
So
Whereas I don't
good.
think I took the time to pause before
Yeah. That's awesome, Julie, for real. That's that right there. I
to
wish I would have
win.
known. Yeah, that with my own kids. I hope that that was an okay thing. And I know my parents didn't know about mine. Yeah.
Do the best we can, right?
Yeah.
I'll go through these last couple super quick.
Okay.
Discipline with purpose and warmth. So learn what discipline approaches are best for a child with ADHD and what can make it worse. Set clear expectations before you go somewhere. Talk to your child, explain how or what kind of behavior we need to have, or force more energy into teaching what your kids what to do instead of reacting to what not to do. Talk about it. Don't shy away from talking about your child about ADHD. Helping them understand ADHD isn't something that's their fault and that there's learn ways they can learn to improve the problems it causes. See, you and me, I even read that and I'm like, I don't like the way that's worded, but I
I'm
get what they're trying to
grinning.
say.
I do, but maybe yeah, at some point we'll
And the
do a whole
last
other
time
episode on yeah.
yeah, we will. This was last medically reviewed in May 2022. So it is pretty current.
Uh-huh.
It's kidshealth.org. I don't love some of the verbiage and I know you don't either, but I think we're getting the idea still. We just would do a better job writing it is all we're
Mhm.
saying.
Well,
Okay, the last two.
you go.
Oh, the
Well,
last two.
okay. I be all dramatic. I was like, okay, but I do think this is my impulsivity, but I love that we're on the same page with that. And I like that you're saying 2022, all that stuff. But I do think the more that and I would maybe guess I should ask you if you find this too, the more that I'm generating my own content, I've been doing so 15 years or whatever, the more experience I have, the more reps I have of being me and interacting and reading. And I've been going so big lately that everything is an opportunity for me to use it. What do I think about it? What my muse, and I still am all, I want to work from an evidence-based model. But then you realize so many people that are writing articles are just looking up other articles to get information for their article. And so sometimes I think a lot of information is passed along that isn't necessarily accurate, that sounds pretty good. And so I think that even an article like this is a muse for us to then say, because what do we
Mm,
think? And so the last three that you did, I'm smiling because I think the tides are turning with, because all I'm hearing still is make sure you are still telling them what to do. Make sure that you are making sure that they understand what's important. Make sure there's a lack of curiosity kind of
very
underlying all
you
this.
focused,
Yeah, there
very
you go.
parent focused still.
Yeah,
Yep.
yeah.
I see what you're saying.
So you'll feel good as a parent and you will get rid of some of your discomfort for right now. But the kid's sitting there like, I have ADHD. Like, I'm not even paying attention right now. That kind of thing.
Right.
Yeah. But I like that.
Interesting. Thanks for pointing that out. Okay, the last two, spend special time together every day, make time to talk and enjoy
That's good.
relaxing, fun activities with your kids, compliment positive behaviors. It
Yes.
does say don't overpraise, but do comment when your child does something good. For example, when your child wastes their turn, say, you're taking turns so nicely.
I like that.
Last one, and this is my favorite, your relationship with your child matters most. Kids with ADHD often feel they're letting others down, doing things wrong, or not being good. Protect your child's self esteem by being patient, understanding, and accepting. Let your child know you believe in them and see all the good things about them. Build resilience by keeping your relationship with your child positive and loving. And I do love that because for me, the phrase that I most often think of with myself that I feel challenged by, that I hear myself say if I'm being hard on myself, is I'm too much.
Hmm.
I'm too much,
Yeah.
right? Letting others down, doing things wrong, or not being good. For me, that looks like I'm just a lot.
Man, and Julie, you are awesome.
Thank you. So are you.
Oh, you're kind. I get these like hyper focuses. Fascinating enough, that's what people with ADHD have. And one of them is this, I think we've talked about it, the origin story of the what's wrong with me and the a kid's being a kid and they're continually told they're kidding wrong. That, oh, not calm down, sit up straight, tuck your shirt in, oh, not so loud. Then, and especially an ADHD kid who's doing a lot of stuff, then eventually they're just like, I am existing and it is wrong. So then I'm going to try
Yes,
to internalize my emotions. And now I need somebody else to tell me if I'm doing it okay. But I'm still like, and so you can start to see, I think that's a little bit of that origin story of the rejection sensitivity. Because boy, kids are already being told they're doing it wrong a lot from a well meaning parent that our job is to try to teach them the proverbial right from wrong. But I think that we maybe need to revamp that a little bit too and try to understand them and then help guide them toward what works or doesn't work for them. Anyway, let's kick that
for
one
sure.
on down the road. Yeah.
And yeah, maybe next time or in a few, we have you take the nurtured heart approach to
Yes, I would
this.
love to. Yeah.
Because
Yeah.
I think that would be because I've listened to you a lot talk about nurtured heart approach. And I come from more the school of thought that I just learned as a teacher, which is love and logic, which I know there's a lot
We're
of
pretty similar.
similarities
Yeah.
there. Yeah, pretty
Yeah.
similar. Should we end with a love note?
Yeah. Do you have one?
Well, I Tony, I never have one. We always make it up on the fly, but
I
yes, I
know.
will make one
This
up
is
on
where
it.
my joke brain can't.
I
I
know.
just, okay.
Dear Abigail, you are awesome. You're a mom, you love your kids, and you have one of your kids that you wonder about if maybe they have ADHD. There's some things that sound similar to them in this podcast and the things that you've read. And I,
They do.
ADHD,
They do, Abigail, but go ahead.
you're confusing me now. I want you to know that I, ADHD, am not here to hurt your child, but I am here to just be and to hang. And your child is a genius, and also their focus is different than some of the mainstream children you see. And that is not right or wrong, good or bad. It just is. And I'm pumped for you to learn more about me so that you can find out that I'm not something to be afraid of, but something to be utilized. Love ADHD.
P.S. Get the little plugs over the outlets because they'll probably stick scissors in them as well.
And there you have it.
There we go. Julie, we're back. So
It's
nice.
awesome. So good to be back. We've had a lot. Thanks everybody for joining us. And until next time, our next episode on Love ADHD. See you later.
Bye.
Bye.